My name is Peter van Galen. I represent the European Multiple Sclerosis Platform as a consultant. I'm actually one of the patients I represent myself, so that puts me in a unique position to either be a patient and share data is one thing, but also my experiences, of course. And it's high on my interest list because I hope anything that comes from this can actually benefit me in the long term personally. So it's a very self-fulfilling kind of job. The added value for me as a person, I am myself a person living with MS. I feel, I think it's a very important thing to share information and data in order to hopefully in the end create better outcomes for me as a patient, very personal, but also other patients can benefit from my experiences and the data that I can bring in. So that's on a personal level. I think on a level for the society I represent is also we try to gather information. I give you an example. We, for instance, gathered lots of information from our different societies within Europe on access for treatments. Now, access in treatment is not very easy for every country within Europe, although we're all under the umbrella of the European flag. Access remains a problem, and when you have data, you can measure the data, and therefore you can also bring it up to a certain level, a European level, to talk about it. So that's definitely an important thing. The IHD really opened my eyes to what big data or data in general can do to better the outcomes for the organization I represent, and in the end the patients, of course. By sharing information, I think sharing is a key word, because if you keep the information to yourself, nobody knows about it. Another important factor is also the measurement of the data that you gather. If you have something to measure, you can take it up to another level and say, okay, this is the information we gathered. If you just shout into the wind, nobody hears you. But if you shout with something on paper or on data, then you have a much stronger voice to get your word across. Just gathering data, I think, is not enough. Gathering data is a first step, but you can best gather quality data. If the data is not of a certain quality or a certain structure, we can try to restructure. But if you just gather information for gathering it, you have a lot of noise within the data, and garbage in is garbage out in the end. So I feel strongly about how to structure and to really think not just for one organization, but within the organization IHD, how can we find quality information, or how can we get the information that we get in, quantify and qualify it especially. Because the information is not bad, it's just maybe structured in a different way, and depending on the questions you ask to the data is the outcome you're going to get. So also thinking about what questions can we ask the data that we currently have to be better useful in the end to the means that we're looking for questions to. But quality data is very important. I think working together is key in this. You cannot be on your island and say, I'm going to try and solve this data question and just share data and keep it to myself. The more people are on board, and not just other organizations like EMSP, but also thinking about people that have knowledge of databases, of structuring information, of all types of people that are present here today, has really opened my eyes, and also that helps to create better data, more data, and also to share the experiences they had with the data that they actually collected. Because it's nice to collect something, but what is actually important to me and my organization is what can we do with it, and what is the benefit in the end for our patients that we represent. So if we can share ideas about this, that could also really help and motivate the people to share their information, because people nowadays are quite scared to just share information, although everybody shares on Facebook, but if it becomes a question from data on your healthcare, oh no, they don't want to share anything. I I think IHD can really help our organization to get the word out and to help us to use the data by education, not just education to the people that are already on board, but the wider audience. What can big data do in general, but also on a governmental level? Because governments, they say, okay, yeah, it's great, data, but what's in it for us? If they can even quantify it to see, okay, we can reduce costs by getting a lot of data in, by speeding up the process of inventing new evidence and medication, that would really help and motivate also our patients in order to share the data and to see an actual benefit from it. So a second point I think that could be on the list or my wish list for IHD to focus on is to share best practices, the things that they found out by sharing this data and the things that came out real practical means, to share those examples that we can take back to our patients and think along the same lines. What messages would I like to give to IHD for stakeholders like my own association is, of course, to keep the work what they're doing, increase even more the outward practice that they're currently doing, to share all their knowledge, that's one. Also the platforms that they're currently involved in, and get more and more people on board. On the one hand, too many people won't work either, but to group them into neat areas and get quality data, I think those two things are big on the agenda for me.